So I'm here with Dr. Rachel Heyman, and I've been so excited about this podcast, and I have so many questions that I don't even think we'll get through them all today, but we might do another episode on another occasion. This is a topic that moms go crazy for. And I would like you to start by introducing yourself. We're talking about cranial health today. It's not cranial sacral therapy, but we'll get into that and what the difference is. But talk to me a little bit about yourself and your story. How did this become your passion? Because you're clearly passionate and incredibly knowledgeable in this area.
Oh, well, thank you for that awesome introduction. I'm happy to be here. Thank you. It's an honor to be on your podcast today. And, as with everything, a lot of us alternative healthcare providers, it's usually, fortunately, our own health circumstances that lead us on the journey that we're in and, guide us with ways that how can we better our lives? How can we best heal the implications that we're going through? So, my story is one that entails my own health journey. And I don't have, like an amazing chiropractic story that got me into what I'm doing now. And my practice is very different in general, but it was just the ability for those types of providers to think outside of the box for me. And that's what really started me on my journey of alternative medicine. I was sick very young in life and just wasn't getting answers. We tried conventional medicine for years. And I grew up in a small suburban country town. So we didn't have access to that many things as far as outside of the norm. And so over the years of trying to search for different treatments, I was introduced to different alternative healthcare providers, and it ended up being, related to infectious diseases, which I have a lot of knowledge on now as well. But it wasn't until I actually decided to go into the chiropractic profession that I was introduced to our topic today, which is the world of craniopathy. And I'm sure we'll go into other things as well, but I never heard of it, never knew it existed. We definitely aren't taught about it in chiropractic school at all. And so I was just fortunately introduced to a craniopath who was practicing around where my school was, because I used to suffer from chronic migraines. And I had, lots of other issues going on with that, airway compromise. And, someone recommended that I should go try this professional. So I did, and my eyes were opened and I was like, why isn't everybody doing this? But it's hard. It's a lot of training. It's a lot of work to get where I am now. But that really opened my eyes to, I really wasn't actually treating the full nervous system. And, 80% of the nervous system is above the head, or, in the head region. And as chiropractors, we're really only getting from the neck down. And so it still impacts the nervous system, and it still has a lot of impact for an individual's health of their nervous system and their body. But I was missing a big portion of that. And so, after school, I stayed in his office for several years and just took a bunch of different courses. I then was introduced to like airway dentists and orthodontists and other people's, where I then had to learn some of the dental language to be able to, co-manage cases and do all of this type of work. So, it's been a journey learning all of that things. And then about 5 years ago, I relocated my practice to San Diego. So that's where I practice now. Introduced even more specialists here that, are excellent resources for me now. And I never thought I would treat children. I went in treating, adults, and thought I was mainly going to do nutritional stuff, which I do a lot of nutritional stuff too. But the cranial part, once I learned the such impact of resetting the brain directly, people started bringing in their kids. So I was like, well, I should probably learn how to do this on children. So, I got all of that extra training because a child and a baby is a very different nervous system. And so I started developing that, learning things, but also then putting in my knowledge of other things into that. And so that's how it's kind of crafted into my practice now, where we see lots of different ages all over the spectrum, and we're able to help them in whatever way that we can.
There's always been a link between chiropractic and autism moms in their quest to help their children turn symptoms around. Tell me what this art form that this fraction of it that seems to be most of your focus in your work, what does that do for autism and ADHD behavior, learning issues? Because I know we're going to talk about much more than that, but what is it that, because I love that you say the nervous system is mainly in the head. I had no idea. So take us up there and tell me everything I need to know.
So I should start with the statement that I never specifically treat a diagnosis or condition.
No.
When someone comes into my office with anything, it can be anything. My goal of whatever I do in my practice, and I have like 3 different categories of care in my holistic practice that I do, and I teach my patients about that. But I tell them, everything that I do in here, it's to get your system, your child's system in balance so that it can heal itself, because that's what it's designed to do. You get a cut on your skin, the skin's going to regenerate, you're going to create new cells, you're going to create new skin. And so it's created and designed to do that naturally. It's just there are oftentimes barriers into how, the brain, the body can get into that state of healing. So specifically when we're talking about neurodevelopmental challenges, it actually goes all the way back oftentimes into the womb. It goes into epigenetically what that child has inherited sometimes. And that's not always bad things. We always associate with bad things. It's not always bad things. But unfortunately, with exposure to toxins and all of these things over the years, our genetics have changed. And that's what they do. They change to our environment. So a lot of the neurobiology of how our brain and nervous system develops, it actually starts in the womb. With epigenetics, it starts with the health of the mother. What are they exposed to? What's their stress level? How well are they being taken care of? Is anything passing to the child through the placenta, things of that nature? And all the way back in the womb, you can create tension patterns in your growth and development too. The facial structure of your face is very key to neurodevelopmental conditions, as far as very narrow. Do they have small faces, small jaws? Are they born with something called a tongue tie restriction? Those are all epigenetic influences that have changed over the years due to the child's environment and the parent's environment. So we're seeing this just so much more now. And obviously we have more education about that and what that means. But also we're seeing more about what happens. And so for me, when a child comes in, I'm actually in my history, I'm going back into talking about, what was it like through pregnancy? How was the birth? That's also very important. When we're talking about the neurobiological impacts. Was the mom in labor a long time? Was she pushing a long time? Did they use instruments? Was it a C-section? Was there a cord wrapped around? Like, all of these are really important questions, because that's our first actual physical aspect of trauma to our body. And you can get a lot of information about a child, if we're talking about children specifically, through talking just about their birth and what, happened through their birth. Were they really colicky? Were they really stressed all the time? So all of those are keys that I particularly go back and look at. And I think it's important to talk about something called developmental neuroplasticity.
Yeah.
So this is why, you know, when individuals come in with their children with anything on the spectrum, I always focus on the brain and the nervous system first. You know, oftentimes we can go to detoxing and doing all those things, which are also very important. But there's real key tenets of to how the brain and the nervous system function and how it heals. And our brain and our nervous system, you know, they have to have key things to function. They have to have blood flow and oxygen. They have to have glucose. They have to move. Like, people don't know that nerves have to move. They have to move. The brain has to move. It moves all the time.
Yeah, that is fascinating. You have to talk about that as well. It's just, wow. Yeah.
Yeah, the brain moves because the cranial system moves every time we breathe. It moves in different areas, just like other systems of our body. So, you know, it relies on movement. It relies on fluids flowing, nerves functioning, fluid getting there. And so right away, if a child has a lot of trauma to their nervous system or in their birth, then a lot of times the nerves are either stretched or they've been pulled through the birth process, or even just in the womb. A lot of times they're stuck in a certain position. You know, or there's just restrictions and fluid isn't flowing, blood isn't flowing. So if we just run to detoxing, we probably won't be as successful because there's nothing really getting those nutrients to where they need to go. And sorry, let me put this on silent so it doesn't ding at me the whole time. There we go. And why this is important is because there's something called developmental neuroplasticity. And it's basically the brain's ability to change. And we have our most dynamic stage of brain growth from the age of 0 to 2 years old.
Yeah.
And it's a real, what we call a critical window in a child's development of what sets up their nervous system for the rest of their life, because that is the most dynamic change in brain growth. So this is why I talk about the birth and the womb, because that's usually what starts it. But we have, you know, you can think of it through developing through those years. It's like, you know, you have a big city going on, and you have all of these like electrical connections, all these electricity, all of these things going on. But the bigger the city gets, the more you have to make, you know, more of those electrical connections to get them, you know, all the services that they need. And as your brain is growing from 0 to 2 years old, you need to be able to grow more connections to be able to do more things. If not, then what happens is that individual or that child, they don't have enough of those brain connections to adapt to the environment that they're adapting to. And so what happens is typically they become like sensory overloaded, because they can only do what they have neurologically connecting and neurologically programmed in their brain from those couple of 2 years of life, depending on their environment. And you have to know the brain only cares about survival. So it's going to prioritize functions in the body, even as an adult, to survive. If it doesn't have, you know, freedom and movement, if it doesn't have oxygen, if it doesn't have a blood flow, then guess what? It's going to prioritize different functions of that body. And so it's going to focus on the lungs filling with air, the heart beating, the nerves firing. It's not going to focus on, you know, the emotional system and regulating their emotions or other, you know, types of functions, because that's not really survival. And so the more we can free up tension in this system, we can get fluid flowing, we can get the brain in a better environment, the more likely they will adapt in those first couple of years of life without creating these patterns in their nervous system of adaptation. And it usually goes one of two ways. It's if their nervous system has adapted And nothing is improper. I mean, the brain just does what it does for survival. But there's usually one or two scenarios where number one is their nervous system has then developed in that environment, and they tend to like pull away from things. So they can't, their nervous system can't really handle too much. So they will pull back. And then the flip side is the nervous system can become where it kind of like needs sensory things to calm it down. And so that's kind of the flip side of the nervous system. What can also happen is they're not really, reclusive. They're more like, no, I need like stimulation because there's something within the sensory part of my nervous system that didn't adapt well. And so a lot of times those types of methods will actually calm their brain down. We think of it as, oh, they're just acting out. But in actuality, in some of those cases, that's how their nervous system adapted. And sensory wise, how it calms itself down.
So would that be stimming and like when they're flapping or I'm always so puzzled about this whole chew toy, sensory toy, swings, all these coping mechanisms that we fall for, because we need to look at what created that need for that kind of coping mechanism, because when these kids grow up, it's not going to work to use these types of that type of behavior and those types of coping strategies. So are you saying that what happens during pregnancy and in the developing years, and maybe even a passive lifestyle in front of an iPad, will then cause these stress reactions in the nervous system so that the child will be seeking stimulation, and that you can fix that by looking at the root cause instead?
Yeah, you gotta look at, so we call it compensation patterns, right? So whatever that nervous system had in its environment is how it will adapt. And so it can go, a couple different ways as far as how the neurological system will form. But oftentimes you'll see that in different scenarios where someone will, or a child will either be very reclusive and not want to talk to anyone, or there's the other child that's like in your face, like, all of these things have to be, and it's not really like necessarily personality, although that can come into play. It's really how their nervous system actually developed because of the environment that it had. And the more we can begin to balance the environment that the nervous system has, the more energy, the more freedom your brain has, the more capacity and energy storage it has to actually make new brain pathways. Because it kind of just goes until it's told to do something else, because that's how it adapted and that's how it formulated. So once it's kind of adapted after 2, you can still change things. It's just you're kind of, fighting against what those neurological circuits formulated because of their environment. But you can still change patterns even in an adult. You can do lots of different things with neuroplasticity. It's just during those first 2 years of life, we have such a huge responsibility in my profession to help their nervous system and brain adapt in a healthy manner.
And how do you help regulate the nervous system by using craniopathy? Is that the word?
Yeah.
Yeah. And what do moms who have older kids do? Because a lot of moms get diagnosed between the age of 4 and 7, get their child diagnosed by that age. And we all know that nervous system is all the rage right now. And there's all these kinds of the polyvagal theory and nervous system exercises. What is it that you do that is different to that?
Yeah, that's a great question. So I don't just treat the cranium. That's just a specialty of mine. I really treat the full body because the nervous system is a connected system. Everything talks and communicates. Your cells communicate to one another. So my job in that kind of phase of care that I'll start people with is to assess where are the limitations happening within the nervous system. So is it that there is too much motion in an area, not enough motion in an area? Now, if you're doing other types of nervous system therapies, remember that nerves, just like muscles, just like organs, they need oxygen, they need food, and they need movement. So if you think about a nerve being compressed, or nerve being stretched, there's not much of those foundational nutrients getting to that nerve. And so oftentimes some of those like stimulation exercises are really difficult to hold on and stick because the nerve doesn't have foundationally what it needs to function. So when someone comes in, I won't even start with some of those things because my first job is to give the brain and nervous system a more optimal environment so that it can.
I love that. I love that because a lot of moms are doing protocols where they have machines doing the vagus nerve stimulation in protocols where they are told doesn't matter with the food, just take olive oil and some fiber sauce and you're good, which is crazy based on what you're telling us now. So how do you provide oxygen and nutrition? I'm really interested in the breathing techniques that moms might be able to implement. Are we talking mouth taping, and how do we know if our children are breathing the way that they should? And most of us probably are not.
Yeah, you can even go actually early on in life, and we call them milestones. So, a lot of pediatricians and whatnot will know about milestones as well. And those as nervous system experts, because that's really what we're trying to focus on is the health of the nervous system, is we go back if we can, and I just ask questions of the parents about some of those milestones, like how did they crawl, how did they walk, what were some of those habits. Now, if I'm seeing a baby, then I can track those as they develop. So that's not a problem for me. But if I'm seeing them a little bit earlier or later in life, then I have to ask those questions. But those neurologically, foundationally, are the first kind of things that we look at, because a lot of children with lots of neurological stress, they probably didn't crawl to walk very well.
Mm-hmm.
They didn't get like those good brain connections. And you can also find a lot of them are like tippy toe walkers. They walk on their tippy toes. And that's a sign to us that there's a lot of stress on the spinal cord and into the brain stem because of internal pressure and internal tissue tension that happens. We call it dural torque in our world. So those are kind of the first things that we look at and we say, okay, did they kind of go through those milestones correctly? If not, we know that the brain created some type of compensation pattern. It had to. That's how it developed. So those are kind of the first things that we look at. And then as a older child, of course, you can look at, kind of the typical things like focus, attention, things of that nature. A big one is sleeping, like you mentioned. So are they sleeping with their mouth open? Are they grinding and clenching their teeth? That's a big one. Do they have like dark circles under their eyes, which is another big sign that they're actually not sleeping through the night very well? Bedwetting, which means their nervous system isn't regulating very well.
So that is linked to bedwetting. Interesting.
Yeah, oxygen, stuff like that. There's something even in adults. So not bedwetting necessarily, but there's something in the brain called the micturition reflex. And when your brain is deprived of oxygen, that reflex will fire, and the person will wake up in the middle of the night thinking they have to go to the bathroom. And that's called the micturition reflex. And the brain does that to keep you alive because you're not getting enough oxygen. But we think, oh, we just wake up and have to go to the bathroom. there's other instances that can make that happen as well chemically, but a lot of the times if someone is having an airway problem, that's the main issue that's going on, is their brain is just not getting enough oxygen. You can also see like a lot of, we call them cranial distortions. So you can actually see like physically changes in the face, where one eye may look smaller, one ear may be turned out, the jaw may be, rotated. A lot of these kiddos have really narrow palates, so they have crooked teeth. Sometimes their like tongue is pushing out their teeth, and their teeth might be spread a little bit in the front. So again, it always goes back to like the development of the face and what we can do to help balance that system. Most of the time with developmental issues, you're gonna find some type of craniofacial problem. I mean, I don't think I've ever found one that doesn't have one.
So crazy.
Yeah, it's pretty crazy. So that's where I always focus on, and then I'll go into some of the diet and all of those things. But absolutely, my recommendation is always to, if you can, find someone that at least works on some part of their nervous system and getting some stuff flowing first. Then you can work on, okay, did they turn into mouth breathing? Can they actually breathe through their nose? So you might want to start, can they breathe through their nose before you start mouth taping? Because that's going to freak them out and give them anxiety if you tape their mouth and they can't breathe through their nose.
Yeah.
So, and we know that nasal breathing for everybody is how we should breathe. If you can't nasal breathe, you're putting your brain into a state of hypersympathetic overdrive. So, working, there's also little devices called the MyoMunchie, which I include for my pediatric patients early on, so that it can help stimulate the muscles of the face, especially if they've had a tongue tie.
Yeah.
Because a tongue tie, they're not really using their tongue effectively, which means that a lot of the musculature in the face is weak. So there's a little like, I don't even know if it's called an orthodontic device, because it's not really meant to like change much, but I have my pediatric patients in between sessions with myself. If they're really young, we can prevent a lot of orthodontic stuff later in their life if we fix a lot of these patterns early. And so the MyoMunchie for my practice is a great addition, because it's just a little device that they chew on, and it stimulates not only the muscles, but it helps like stimulate the palate to give it some stimulation to begin to grow the palate. And why the palate's so important is because that's part of our airway. It's where a lot, the upper palate, the upper mouth I'm talking about, it's basically, I call it like the Pandora's box of the head. Every single bone minus our mandible, which is our jawbone, it functions through that upper palate. So if there are deformities there where it's too narrow, sometimes one side is lower than the other. Maybe the front of it is narrow, but the outside of it is fine. Any part where it's not really optimal for that person, that will affect the whole dynamic of the brain and of the face. So that's why we talk about palate stuff so much, is because it's really like the starting function of the brain and things of that nature. Can that answer your question? I think I got a lot of
that's just every answer just gives me 10 more questions. So that munchie, what's it called? MyoMunchie, is that something that older kids can use and adults as well?
They can, for sure. There's different stages in growth and development in the face and the bone structure. So the most like growth we have up in the upper palate is to about the age of 12. So if a teenager comes in and I've never seen them before, oftentimes we'll have to do a little bit harsher protocols, because we have a very small timeline of getting that palate open. You can still open it as an adult. I did, even though I was done growing. I didn't get as much as I would have loved to, but you're also fighting limitations of your bone structure, so if I had done it early in life, I probably would have got quite a bit more expansion and opening of my airway. But yes, it's still possible as an adult. It's just a lot more work. You have to undo all of those improper patterns that you created with your tongue, with your breathing. Then,
Grinding, yeah,
yeah, well,
clenching.
grinding and clenching usually is you already have airway problems, so you got to fix the airway. But it is possible as an adult. It's just a longer road to get all of those structures finished.
So opening up the airway, you shared on your Instagram, I saw expanders. Is that what you did as an adult to open up your airway? And is that something that's available to everybody?
Yeah, obviously, it depends where you are. It depends on the providers. Now, I think I wouldn't say most people, but a lot of people have heard, in the orthodontic world to use expanders. Like you think of like the old turnkey, like expander things that kids
Yeah.
did. So there's a knowledge that, expansion is necessary for some cases, but it depends provider wise if the dentist who's doing the expansion or the orthodontist who's doing the expansion has actual knowledge in the craniofacial airway dynamics. And unfortunately, a lot of them don't. So a lot of individuals can go into orthodontics and braces and come out worse because it put more stress on the brain. You have to know that teeth are just an extension of bone. So our teeth grow in to how the movement and the balance of our facial bones move. Our facial bones move every time we breathe. They have to move. So if there is improper movement from the birth, say a child also had a head trauma, things of that nature, the teeth are growing in to response of this movement. So traditionally, we would say, okay, well, I'm just going to go to the orthodontist and get my teeth straightened.
Yeah.
But there's a problem with that.
Yeah, I can imagine.
If you try to straighten the teeth, but you didn't actually fix the functional pattern of why the teeth are in that position, what happens is you confuse your brain. Because it goes, wait. I had your teeth in that way for a reason, because I don't have all these things going on. So oftentimes in these cases, like the patients will just be miserable also going through orthodontics. I mean, orthodontics is not fun in general, but I mean, it's just you're fighting an external tension. They'll have lots of headaches, even coming out of braces, lots of headaches. A lot of times they'll even have more of this forward head posture because their head is just totally locked up. So yes, expansion is available, but it depends on the provider. If they're a really good provider, then they're not just gonna throw braces on a child. They're gonna say, oh yeah, they've got some tongue restriction. They've got some improper breathing patterns going on. We're gonna start to work on those and begin to train those things. And then the actual expansion process, there's so many different expanders out there and lots of different providers that do it. I have some of my favorites that my dentists do here, but it's also dependent on the child, because some of the expanders, like you put them in and you wear them for a couple hours a day. That's not going to work for every child, especially if they don't like things in their mouth. There's other ones that, stay a little bit more permanently in there. And over time, as they learn proper mobility of their tongue, all of those things, it will begin to grow out their face naturally as to how they're supposed to grow. Your tongue is actually supposed to grow out your palate if it's moving properly. So there's many different options for that. It's very case dependent on the child's personality, on how compliant they will be. Like a lot of my sensory kiddos, sometimes we have to do a little bit harsher ones just because they're the only ones that stay in permanently. And that's the only success we can get. Otherwise, they're just going to take it out and it won't be successful for them. So,
is there some type of criteria for when moms want to go and find someone who knows these things and will treat it holistically? What do we look for in terms of, what titles? Do you have somewhere where you can link to find a good practitioner worldwide, or is it a niche, really difficult thing to find?
it's definitely getting more out there. So we do have resources. I typically recommend someone first off to see a cranial or osteopath who has some cranial knowledge.
Yeah.
Because you want to start getting things moving, flowing, balanced in the nervous system. Like I said, some of those functional patterns, the nervous system may already be quite stressed. And so if you then try to put something in their mouth and force it open, it could even put their nervous system into even higher stress. So I always typically recommend personally working, if you can, with someone who has some cranial knowledge, or an osteopath if they have some cranial knowledge, to begin to balance the cranium and open up the systems that need to move.
But not necessarily cranial therapy then. Could you describe the difference between what you do and cranial therapy? I know that a lot of moms are reluctant because of the links to New Age, and some of these therapists do Reiki healing and stuff as well. And I know a lot that's not what my moms are after, I know.
No.
So what are the difference? And would that be an alternative? How do we find these people?
Yeah, that's a good question. So I typically have to, well, my staff is trained now to tell people when they call, but I oftentimes have to be able to separate when people call and say they want craniosacral versus what I do. So craniosacral is very basic. The basis of craniosacral is getting something called the spinal fluid balanced in the body. Now, that's a huge focus of mine as well, but I do it differently. Why do we need the spinal fluid balance? Well, that's kind of the plumbing system of your body, of your nervous system. So it gets out all the dead cells, toxins, brings in new nutrients. It also regulates temperature in the brain. It stimulates hormone production. So we need, again, fluids flowing in there. If not, their brain's toxic because they can't flush anything in and out. So you need fluid moving. But craniosacral, you can be a massage therapist and take a craniosacral course in a weekend and call yourself a craniosacral therapist. So it's very basic. A lot of it is just holding on the outside of the body and trying to balance the motion of the fluid as to what they feel. Some craniosacral therapists are very experienced. They've done lots of other types of education. They know, about other things, but I'd say a good majority don't. And people will say, I'm doing cranial work, and they're not really doing cranial work.
Yeah.
So it's important to know the difference of that. You're right, you can get into weird energy things, and you don't want to put that on your children as well. And so it's just probably some, knowledge that you'll have to have if other people have used them, or just, what's really their education. And you'll get a good view of that if they have a good website, or if they have good information about, their success of what they do. The difference of craniopathy care is it's a combination of chiropractic and cranial osteopathy. So we are looking at the entirety of the nervous system, and we're looking at more neurological implications. So we're just not focusing on the fluid flow, which is important, but we're looking at neurologically how things are happening in the entire body. What are all of those neurological circuits doing? How are now the teeth forming and the airway forming? What's the bite like? What's the tongue function? So it's a lot more complex, a lot of education. Like I said, I had to learn dentistry things that I didn't really have a desire to learn, but here I am. So it's a lot more neurological implications, because if I, move something here, what's going to happen in the body? What's going to change in the body? And it's, in my opinion, you need a lot more education, because you can easily ignite something as you can calm something down. So you need to know what you're doing. But additionally, it's so much more impactful. I mean, I have kiddos that, they're just wild. And if we can get them on the table and just move some things, it's mostly what I do is all inside of the mouth. So it's all moving the cranial system through mostly that upper palate, because that's where you can move everything. And so it's very amazing how, if we can get them on the table and just move a few things, like within minutes, their nervous system will start calming down. And that's because we're directly taking pressure off of the brain, pressure off of the nerves, getting that fluid pump channel to flow again. And also it makes a lot of those nutritional therapies successful, because we can get those nutrients to where they need to go.
Fascinating. So do you see a lot of children with autism and ADHD get better and then maintain that improvement, or do they need to come for regular visits?
It's very case dependent. So, I'm a firm believer that everybody's probably going to need some for the rest of their life, because we all have a nervous system.
Yeah.
The amount, though, will change, right? The amount, depending on your stress, your diet, your lifestyle, that's going to change for sure. But if we're moving and, all the time and being active, then to some extent, we'll need some nervous system help to keep our nervous system in check. But for kiddos, it's very case dependent. It depends how severe they are when they come in, and processes that we're doing. So like I said, I have different sections in my office that we focus on. Just the first stage is this part that we're talking about, which is the nervous system. So usually I'll start them with that. It depends if the parents will actually do the orthodontic stuff that the child needs. Sometimes we have to wait till a certain age because they're just not going to do it. So we just kind of go with, more maintenance care, keeping them what they can do until we get to a point where they can actually fix the airway, if I'm not seeing them really early on. Other cases, they're doing really well. Like, we've cleared their nervous system, we've done the work, we've cleaned out their body of toxins and parasites and all of these different things. We worked on the emotional traumas and things of that nature. A lot of times they're pretty good. They just come in for maintenance care, or the parents will be like, yeah, Jimmy really, really needs this. He's just acting not like himself. And then he'll come in and we'll, rebalance everything. And then the parents like, yeah, they're back to their normal self. So unfortunately, it's case dependent. It depends how much is going on in there, how much trauma is there to the nervous system and the brain. And then, once we get to a point of maintenance, like, how far can we push it back to just keep them at that rate? I recently presented at a research conference last year on a case that I had of a child with autism, and they came to my office like after the age of 2. So, there's a little bit of limitation there, but I've been seeing him for probably a couple of years now. And, he used to come in and bite and scream and like very hard to treat in general. And now most of the time, there's always some of those off days, but he also wasn't able to keep eye contact, things of that nature. Was very just wouldn't play with people. And it was a vaccine injury case, so we knew that was going on, which is pretty common. But I knew he had crooked teeth. He had all of these things going on. I knew he was an airway case. I knew his cranial system was probably super stressed out. So I just started working with him. It started very little I could do because you can't do much when they're biting and screaming. Um, so you work with their energies, you work with what you can. And now he'll lay on the table. Like there'll still be some days where he'll cry a little bit because no kid likes your fingers in their mouth. But now he's able to lie. He's able to make contact. He's doing like occupational therapies now, and he's speaking, he's saying words, he plays with his siblings.
Wow.
So it's all about, I don't know to what extent he'll get to, but I'm just here to support the growth and development as his body changes and help him develop to his highest potential and hopefully become like, actually a functioning adult where he's not reliant on his parents for the rest of his life. So there's lots of other therapies that can help support them that I'm all for, but my job is just to make sure now, probably about when he gets to the age of 6, then we'll be able to really change his palate. You can do earlier things, but I know him personality wise will not do them. So you just got to know the child.
Yeah.
So we're just waiting till he gets to about the age of 6, which is where some of the biggest changes of growth happen in the palate. But I've seen kiddos, if they're really great, like we've done it even earlier than 6, where we've started to open their palate with very gentle, cranial friendly types of expanders. We're not talking about the really harsh orthodontic ones. There's other ones you can utilize. So you can start earlier than 6. 6 is just kind of the cutoff if I've never seen a kid and they come in, and I'll screen them for that. And I say, okay, we're going to do this for a little bit, but we're going to get starting with expansion really soon because we have about till 14, but we have kind of really big start of growth between the ages of 6 to 8. So those are ages that I'm screening for.
Oh, that's so important for moms to know. What about tongue tie and lip tie? I know that there's a lot of moms in the community who say they've had extremely positive results and changes in behavior and symptoms from getting that fixed. What is it? You already explained why it happens more frequently, but the skeptics say, well, we need to leave the body the way that it's created. It's like circumcision. It seems quite intrusive. What are some of the considerations that we need to know about when it comes to this and checking for this? Because some moms don't even know that it exists.
Yes. So I'm very conservative in the fact that I don't recommend that every child go get it cut. And I think when we started learning about tongue ties, that's what would happen is, every single tongue tie that we found, we would snip. And I will say personally, though, that there are some cases where it's definitely needed. And why is it? Well, like I talked about initially, there's a lot of epigenetic changes now with our diet and all of those things where there's something called methylation pathway in your body. A lot of people now have genetic variations in that methylation pathway to how we actually develop connective tissue, because a tongue tie, what it is, it's an extra piece of what's called fascial tissue underneath your tongue. We have some of that already, or else our tongue will just flap out, but it's literally extra built connective tissue there. And it can be in your tongue, it can be in your lips, it can be in your cheeks. And if you're building more connective tissue than what you normally have, that means there's some type of variation that happened in the ability to construct and deconstruct connective tissue through development. So that's kind of how it starts. We now have more recognition of what tongue ties actually do developmentally through a child and through an adult. So you have to know that medicine in its entirety is not that old. We're still learning all of the time. And so we learn ways of Okay, yeah, we didn't know that that had such implications on the development of the face and of the airway and of all of these things. But the more that we do research and the more that we are able to, this is why such good quality research is so important. The more we're able to do that, the more we find, oh, yeah, this really does impact someone. So, what I would say to that is yes, not every case is a surgical case. But if there is a very significant, if we're just talking about the tongue, if there's a very significant tongue restriction where that child cannot lift their tongue to the roof of their mouth, number one, what's going to happen is it creates this tension pattern along the front side of the body because that tissue called fascia, it connects to every joint, every organ, every muscle. It surrounds, like an encasing that surrounds everything. And it's called the anterior fascial line. So number one, what's going to create? It's going to create a lot of tension to pull that front of that body forward. And what happens is then the tongue follows that. And so the tongue, because it doesn't lift up to the roof of the mouth, number one, it can create a lot of those narrow faces, which then create sleep apnea in children, airway dysfunction. And we know through research that airway and sleep apnea causes developmental behavioral changes in children. We know that through research because of lack of oxygen.
That's so wild. So would that also be linked to picky eating and nonverbal autism?
Yeah. A lot of tongue restriction stuff is, they can be picky eaters. Sometimes they'll have a lisp or it's just hard to pronounce certain words. Sometimes like food aversion or like, they just, don't like that stuff. So that's not solely tongue tied, but we put these things together and for that child. So if they can't lift their tongue up, not only are they then developing a very narrow face, additionally, they're not actually stimulating certain nerves in the face. And so what can happen is that a lot of those nerves are part of what's called the parasympathetic part of our nervous system. So it's the very calming, rest and digest system of our nervous system. So if the tongue is not moving properly, not stimulating the palate properly, then they probably aren't swallowing properly, breathing properly. That puts their brain back into that sympathetic overdrive. Is that that can affect not only how their brain develops, it can affect their digestive system because you need that parasympathetic working to digest their food. It affects in response to that something called the vagus nerve, because the vagus nerve is a huge nerve that starts in the back of the cranium and goes all the way down to the abdomen. It does so many different functions, but if we're just talking about the tongue, it also helps lift the back of the palate. So if the tongue is restricted and not really activating that vagus nerve, then the vagus nerve is also going to be understimulated and not working properly. So those are just some points as to why, if it is really restricted, we have a lot more knowledge of it now because of breastfeeding. Women are breastfeeding more, which is beautiful. That's what we should be doing if we can. There's no judgment otherwise, but if we can. And so we recognize that, the tongue and the lip restrictions are really limiting a child's ability to nurse properly. And so that's where we've initially gained more education in tongue and lip tie restrictions, because we want that child to nurse properly. But if it's later on in life, they've kind of already developed all these patterns. So at that point, I'm not really interested in them nursing because they're not nursing anymore. But I'm interested in how are they developing the facial dynamics? How is oxygen getting to the brain? Oxygen is the number one nutrient. And then how is that then causing the brain to either be in sympathetic or parasympathetic? And so that's why the tongue is important. But if it's just tight, maybe there's a little tie there. Remember, fascia is connected to the whole system. So oftentimes, by releasing the stress on the spine, on the neck, on the head, you can get the tongue moving properly and they don't need a tongue tie revision. So it's not necessary for every case, but when it is necessary, it can be very profound because it changes the way that they're, eating, swallowing, doing all of those things, but also neurologically how their brain is functioning.
I just want to mention, because I know when people are listening to this, they will probably want to go and do these things. And if you go and do dentistry or any oral work or any surgery, just make sure that the child never gets nitrous oxide, because it completely depletes the body from B12. And I just want to say that everywhere I can, because we've seen in the community some irreversible damage. It can really damage the brain, because these kids are often low on B12 in the first place, and they have methylation issues. So they do have issues in general. So just make sure that laughing gas, no thanks.
They use like just a topical numbing agent. Like when I got mine done as an adult, it's just a topical numbing agent. So a lot of them don't use nitric for the tongue tie release. Or they can just inject a little numbing agent in there. And it wears off in a couple hours. So they're typically not doing that for tongue tie revisions. It's just like a topical localized numbing agent to, laser or cut the tissue there.
Perfect. What about migraines? It's a big thing in many kids and adults as well. Is that linked to all of these things that we can regulate by looking at balancing the nervous system and getting some more oxygen into the body and expanding?
Yes. So same rules apply. The brain needs oxygen, movement, nutrients. I like to tell people, pain is just a signal. So it's not a bullseye as to this is where the problem is. It's just a signal that your brain is giving that something is out of balance. So specifically for a migraine, it's telling us, hey, the brain is inflamed or the nervous system is inflamed, like something is inflaming it. So it could be a fluid issue where either the cranial bones or the neck or some structural issue is not having optimal movement. And so when the blood flow gets restricted, when fluid gets restricted, that creates a pressure change, and it can create tension in the muscles, can create tension in those systems. And then the brain will fire certain things, and then you can get a headache. So that's one portion. There's other aspects to migraines. They could be multifaceted. It could be toxicity in the body and the nervous system that are creating those pain signals. Sometimes there can be hidden traumas in the nervous system that are causing the brain to be in a state of stress. So there's many different causation agents to migraines, but my method is always going to be the same. Let's start with movement. Let's get things moving. Let's get things flowing. Let's get lymphatic fluid moving. Let's get, your airway working better. And then I can start to either detox them or purge things or just balance their hormones, whatever it is that they need to get those cortical circuits back into a state of balance. But if you're having migraines, your child is having migraines, that's not normal by any means. Yeah, it's their brain is on fire. So you have to figure out what is causing the fires and then, treat appropriately that way.
Perfect. Is there anything that moms can do, that we can do, to regulate the vagus nerve, to stimulate the nervous system and to get things flowing? So what would be some practical tips that you could give us? Mouth taping, I didn't know if children could do that, but things along those lines that we can do at home. Is there anything, or do we need to, of course, I know everyone's going to want to find you and all of us in Europe, what are we going to do? I'm just thinking.
Osteopathic practice, it started mostly in Europe. So I guarantee that you'll be able to find some osteopathic physicians that are good and that can do, some cranial work to help that. But yeah, absolutely. There's stuff you can do. You can mouth tape your kids, but it's important to make sure that they can breathe out of their nose first. Like if they're very congested, you might want to start, if you don't have cranial therapists, maybe working with someone who can do some lymphatic work, lymphatic flow. And you can even learn some of those things on your own as far as how the lymphatic system works to do it on your kiddos.
That will work for the nervous system as well? Or?
Yes, because nerves need oxygen and fluid.
So gua sha, for example, and cupping would work.
Mm-hmm. Yes. So I tell people it's not necessarily when you do lymphatic work, it's not necessarily the tool that makes it important. It's how you do it. Because it works like a channel. So you could use your hands, you could use gua sha, you could use cupping. The actual method of what you do isn't as important as the order in which you do it.
Oh, tell me about that.
The order in which you do it is how the lymphatic system flows is head down. So when you're doing a lymphatic system opening, there's a doctor who teaches a lot about the lymphatic system. He was on my podcast. His name's Dr. Perry Nicholson.
Okay.
Does a lot. He even has some courses for the lymphatic system that help teach you to do this on your own. He talks about like the big channels that are in our body and working those channels. So when you learn about lymphatic stuff, they'll always say, say you have like a dry brush or something you're using, they'll say, start with the legs and work your way towards the heart. That is not how the lymphatic system moves.
They are all doing it wrong then.
They're all doing it wrong.
Wow.
How the lymphatic system works is top down. And it works kind of like a channel, like a gate. So we start the head, the neck, this region. We go down, there's a big channel here at your sternum into your clavicle, okay? Then into your armpits, into your abdomen, into your groin, into your knees.
Yeah.
That's the order that you need to go for lymphatic system. And you'll feel it like when you do it that order, if something feels real hard or sticky, if you're doing it, you'll notice, oh, as I'm doing this, it's actually already opening up because it works like a channel. So if you go against gravity, you're not really going to open up that system very well. You have to go with gravity and how those channels open and move. So lymphatic system support is also very important. Something parents can do on their own. And so if the child is not nasal breathing, you might want to start opening that up, doing some nasal sprays. A lot of times, sometimes they can have mold in their sinuses and stuff like that. So you want to make sure that they can actually breathe through their nose before you do mouth taping with them. You can do things like the Myo Munchie, which is a great addition that anyone can use to help stimulate. Also, that's a great device to use to transition kids off pacifiers, thumb sucking, which are terrible for their palate. So if you're using a pacifier for your children, please stop using them. I've seen them completely deform a child's face. So what I've had parents do is just like tie their little Myo Munchie to like, the little pacifier animal things they have now. And they use that as their pacifier. And it actually begins to build out. So whatever you can do, be creative. You can create a sticker chart of whatever you want to do to get your kids to do it every day. The Myo Munchie, I would say, is an awesome thing that you can do on your own right off the bat. You don't even have to do cranial work, but it does help optimize it.
You did have a nervous system exercise to balance the nervous system. I think I saw that somewhere or not.
Yeah, I actually have lots of tips in my book all about the vagus nerve. I have ways to help stimulate, but I tell people, do the stimulation after you've already moved all the fluids and whatnot. Because again, you need to move first or else the stimulation won't really work well. So there's lots of things that you can do to stimulate. Teaching your child how to actually breathe properly out of their diaphragm is one of the best ways to help reset their vagus nerve and their nervous system. So I talk about that in my book. There's also things you can do, like a lot of what's called myofunctional therapy, which is basically retraining the tongue, all of those things. You're actually really stimulating the vagus nerve when you do a lot of those exercises. So things like running your tongue along the roof of your mouth, back and forth. There's other exercises that I mentioned that more adults can do with their body to get their system back into parasympathetic is really helpful. The nervous system also loves light. So doing exercises out when it's sunny. If you don't have access to that in the winter months, getting under something like red light is very nourishing for the brain and the neurological system. So while you're doing those stimulating exercises, if they're under the light, then it will actually make a more impactful retraining there. And a lot of nervous system retraining that I do actually in my office, I'm always using red light and infrared light to help give the nervous system food so that it can retrain some of those patterns. So if you can even get under red light or out in the sun doing some of these things, oftentimes you'll find that they will stick a lot better too.
So, and also like the sunlight and infrasauna, I've got the tube light behind me, and then outdoor time, that would be a good idea too.
Absolutely. Yeah. So sunlight has all of those wavelengths, but of course, if we're, busy in our day, or it's definitely during the winter months where we don't have as much sunlight, then getting in front of one of those mats, or I've had some people even just, cheaply buy some red light bulbs and put them in a room and just get in there with their kiddos and do some of these exercises can be really helpful. They also have, so one of the things I mentioned too with a bit of older children is something called vision therapy. And that's just because their brain, all of that stuff I talked about initially, their brain caused dysfunction in their eyes. Okay. But a lot of the vision therapy therapists that I work with, they'll do things like light therapy for the brain and for the eyes to help calm them down. So you can have like color therapy glasses or color therapy in a room where it's quiet. And they kind of like determine what colors are best, but you can also just play around and get different color glasses and be like, oh, this one, like, they love it. And they'll tell you because they'll keep them on or they'll toss them off, like, I don't like these. It's not how they feel. So the visual system is also very important for brain regulation, but it always starts back with the development. As an adult, though, then you can fix those visual patterns and begin to train them as well. So those are tips that you can use. All that's in the book.
So we'll be linking to the book in the podcast description. So go to the episode for that. I'll also talk about that in my outro. But one last thing I want to ask you is a fascinating thing I saw you talk about, which is mobility and core health being linked to the jaw and tension in the head. Could you talk a little bit about that and how we can use release techniques maybe to get a stronger core and more mobility so that we don't have this stiffness and pain?
Yes, that's a loaded question. I don't know if that's an easy answer, but there's a couple different facets to that. So first off, the first facet of that is when I was talking about the tongue, and I talked about that fascial line down the front of your body. Is even without a tongue tie, we still have a fascial line down the front side of our body. But our tongue actually acts like a rudder to that system. And so if the tongue is actually properly up to the roof of the mouth, it basically ignites that system in the front line of your body. So I tell people when they're working out, once I train them where your tongue goes, to keep the tongue to the roof of their mouth and then to do an exercise and see how it feels. And without a doubt, just doing that, people will say, oh yeah, like I could feel like my core was engaged way better. I could lift more weight, whatever it was that they were doing. So the tongue acts like a rudder to that anterior fascial line. And so if it's down and low, it's not really going to be activating that system, versus up and high, you're going to be engaging, and then it can act kind of like a rudder to that system. So that's number one. And then number two is in how our mechanical system moves, how our jaws move anterior and posteriorly goes along with our hips. Okay. So I've had people that are extremely tight clenchers, airway cases, and their hips are always constantly tight too. And they're just always trying to release their hips, release their hips, release their hips. And we release their head and their hip completely lets go. Why? Well, there's a neurological connection there of how these systems work. These bones neurologically are connected to the same motion as the pelvis, and vice versa. If there's instability in the pelvis, a lot with women, it's too loose in the pelvis because of hormones and if they've had children. And then sometimes there's tension in the pelvic floor, then that can also cause instability in the jaw. And so, like I said, it's a full body approach to stabilization. So if you work on kind of stabilizing the mouth and the tongue, that can actually give you more activation in your core. Or if you have a really weak pelvic floor, you'll also find that some of the tension up here may also release once you actually begin to rehab that properly, because of the neurological connection between the two.
Totally mind-blowing. I just want to thank you from every cell and fiber in my body for this. I know this is going to be one of the most downloaded episodes because of the excitement that's already around this whole topic and you. So I just want to thank you so much for sharing your wisdom and for the work that you do. Could you please tell everyone where to find you and follow you and get your book and get an appointment?
Yes, no problem. So I'm on social media, of course, like everybody these days. On Instagram, Dr. Rachel, TikTok, Dr. Rachel Hamill is my TikTok. And then my website is drrachelhamill.com, where you can sign up for my blog that I do. You can learn about different resources that I have, a lot of research articles that I've done. And then my book is called Freedom Brain. It's available on Amazon. I think it's on Barnes and Nobles as well, but mostly Amazon. So you can order it there, and it ships worldwide, so you can get it wherever you are.
That's perfect. I'll link to that on the description page as well, the podcast page. Yeah. Thank you so much. And I really hope to bring you on again and into my community for some masterclasses, because this is just mind blowing. And, 1 hour and 18 minutes is not enough. I feel, because I'm just so curious about this. So thank you so much. And yeah, just bring the wisdom to everyone out there. We're going to do the same to try and talk to people about this work that you do. Thank you.
My pleasure. Thank you for having me.